Hi, I am Dr. Gunadhar Padhi, Consultant Critical Care Medicine in charge and coordinator, Apollo Hospital, Navi Mumbai. So today the discussion will be regarding a very important topic: how to manage a bleeding wound and how to manage bleeding from the skin or in the soft tissues. So the basic purpose is to focus on the first aid treatment of a bleeding patient. So the bleeding can be minor or it can be severe. So the most important thing, if you see that the bleeding is severe or the bleeding area is near vital parts of patients, like near the face, near the eyes, or if you suspect severe bleeding from the abdomen where the patient is getting dizziness or patient is going into low blood pressure or the patient is, you feel that the patient might collapse. So those cases are called the severe bleeding. So one should not neglect the severe bleeding. It is very important to identify severe bleeding and major bleeding and differentiate it from the minor bleeding. So in case of a major bleeding, the first thing is to inform to the nearest hospital or the nearest medical center so that the patient can be transported to the nearest hospital or the medical center for the further care. And in the meantime, if possible, if the bleeding source is visible, the one has to compress it deeply and compress it properly so that the bleeding from that particular area is stops. In case of minor bleeding, it is very important to identify the area of the bleeding, and if the bleeding is nearer to some vital area like the face or the eyes or some of the organs, which is very important, those bleedings should be ideally notified, and as a first aid treatment, the first thing is to stop the bleeding. So to stop the bleeding, one has to press that bleeding area with some pressures, and he has to check that bleeding area, and he has to clean that bleeding area, and he has to see that there should not be any kind of dirt or any kind of debris which is lost in that bleeding area. So the cleaning of the wound, bleeding wound, is done by basically the normal water with the soap solution. One should not use hydrogen peroxide or any kind of irritant that causes further bleeding to that particular area. And after the bleeding area is cleaned with soap and normal water, then one has to apply gentle pressure if the bleeding area is or the size is more, and sometimes the pressure should be applied tightly so that the bleeding stops. Even if after applying the tight pressure, sometimes the gauze that might get soaked, in that case the person should not try to attempt to change that gauze and do not release the pressure. This is very, very important. And after the bleeding stops, one has to again inspect, and if possible, he has to apply the local antibiotic cream or local antibiotic ointment to cover that bleeding area, and then alert the physicians or surgeons immediately and take the patient to the nearest hospital. Sometimes the minor bleeding can be managed at homes, just now I have described, but if you suspect the bleeding size is more than half inches or particularly 1/4 inches on the face or vital area of the patient body, those bleedings should be immediately notified, and preferably in such cases, sometimes the patient may require suturing and other different material like some glue applications to oppose the bleeding surface and stop the bleeding. So it is very important that bleeding should never be neglected, and always the patient blood pressure, heart rate should always be checked whenever there is any ongoing bleeding, and the patient should be admitted immediately to the hospital, and the patient care, further care to be taken care by the hospital doctor. So thank you, and thanks once again.